Melissa, and I'm here at Kent State University at Trumbull. We are here today to talk about the Area Health Education Center Scholars Program. I'm very excited about our presenters today. We have Miss Maureen Drummond. She is the, Eastern Ohio AHEC Center Director. And we also have Chelsea Palmer. She's a Kent State Trumbull nursing student who is part of the AHEC Scholars Program. So thank you both for joining us today. We're gonna jump right in and get some questions answered. Maureen, why don't you start by telling us how long you've been part of AHEC and in what capacity?
So I've known about AHEC and actually been part of it for 30 years. As an undergraduate, I did an internship with the AHEC in Youngstown, and at that point it was known as the Mahoning-Shenango Area Health Education Network. AHEC started in 1971 to recruit, train, and retrain health professions workforces committed to underserved populations. Actually, Eastern Ohio AHEC changed its name somewhere in the 1990s, I think. And they're the oldest AHEC in the state. And so my service with the organization has fluctuated between serving on the board, being a volunteer during those 30 years, and now I'm center director.
Awesome. Thank you again for joining us today.
Sure.
Chelsea, go ahead. Chelsea, how long have you been part of AHEC and in what capacity?
Sure. It is now officially a year that I've been a member. And I was just telling Maureen before we come on, I can't believe it's already been a year. I feel like it went so fast. And I am a student, at Kent State Trumbull. And I became a member then. The year runs from September to August. So.
All right. Well, welcome.
Thank you.
Now we're going to get into some of the details. Maureen, who better to talk about these details than you? So let's start with the basics. AHEC, what is an Area Health Education Center?
So an Area Health Education Center has three primary focuses. One is pipeline, and those are programs that interest students in grades 9 through 12. That's 10% of our work burden. 80% of our work burden is the AHEC Scholars program, and this is a new initiative to AHEC. We started 3 years ago. Our grants run in 5-year cycles, so we have 2 more years to this grant cycle. And I'm pretty sure that the Health Services Administration, who funds us, will keep the program running because it's been that impactful to students, number one, and also to workforce development. So most of the things that we do focus around workforce development, and our strength is the ability to creatively adapt national initiatives to help address local and regional healthcare issues. So let me backtrack and say that the other 10% of our work burden is to help credentialed and licensed professionals who are in the workforce to maintain their certification and licenses. So a lot of what we do focuses around education, but it also focuses on experiences, and that's where we developed the AHEC Scholars program to give students in undergraduate and graduate programs an opportunity to experience things outside of their healthcare curriculums.
Fantastic. And Chelsea, you've been an AHEC Scholar for a year, you said. What does this mean to you? What is it like being a nursing student in the AHEC program? And what are some of your experiences with that?
Sure. It's been an incredible experience that's provided me with a lot of opportunities that I'm thankful for. Just to name a few of some of the things that I've participated in the past year. We did Narcan training. The AHEC Scholars did Narcan training. So we received our certificate and our packet through Project Dawn to provide Narcan assistance should we need to. We did a webinar on trauma-informed care for Holocaust survivors. So that was actually with the psychologist, Dr. Jessica Ruiz. And she taught us in the elderly population, we might be caring for Holocaust survivors. And she brought to light a lot of things that we might not think of that might be triggers for them, and how we can work through that and to provide them with the best care that we can provide. It's also given us a chance to meet healthcare officials. Right now, with what we're going through, with obviously with the pandemic, like we're in a very interesting and unique time, and our trainings become very relevant. We met with Erin Bishop, the Youngstown City Health Commissioner, at the start of the pandemic. And we were able to discuss with her like what this looks for in a city health department, and a city health department to the, you know, size of Youngstown and the special populations that we have within Youngstown. So that was a very eye-opening and interesting experience. We met with a representative from YCAT, and we discussed human trafficking, not just as it is an issue in our country, but it was very specific to our area. So we were able to learn what to look for, how to properly work with victims of human trafficking, the signs to look for, and then what to do should we suspect that someone is a victim of human trafficking. And we met with Derek Rubicki, who is a senior officer with the Federal Bureau of Prisons, and he discussed with us how we can properly care for and what we can expect when we are working with the prisoner population in a hospital setting. So I feel like it's really just, it's prepared me. I feel a lot more prepared to go into the clinical experience as a nurse, having been involved in these trainings. And it's really opened my eyes to a lot of things that I, didn't even consider before.
That sounds amazing, Chelsea. Thanks for sharing. Maureen, so who can fill out an application to be part of the AHEC Scholars program?
So each AHEC Scholars cohort consists of 15 students. We do review applications for appropriate placement. Scholars need to be in their last 2 years of a dedicated curriculum. And that means they've reached at least the junior status, or they may be in a program where, there's a lot of kids who go to college and high school, and they come to a college campus as a freshman, but their credits are actually junior status credits. So that's why we ask people to apply, and we look at their applications and we interview them, and we talk about whether or not this is a good fit for them. But they have to be associated with a healthcare discipline, or they have to have an interest in a healthcare discipline. So we're looking at nursing, pre-med, respiratory care, social work, exercise science, physical therapy, speech pathology, anything that can be housed in a College of Health and Human Services or Health Services College, depending on the campus that you're on. Because this is a regional program, our hub is at Neomed, the medical school in Rootstown. And so our program office is there. And we do a lot of discussion and talking and planning about, what do we want the cohort of Northeast Ohio scholars to look like? The two premises behind this program is making sure that practitioners are prepared for interprofessional practice, and that they're aware of social determinants of health. So when they go into either an urban setting or a rural setting, or where there's underserved healthcare needs, the training we provide helps them be aware of what they need to know about a patient, so that a patient's care is optimized by that interprofessional approach. So just as Chelsea mentioned, she's learned a lot of things about patient care that she might not have had the experience had she not been in AHEC Scholars.
Sure. That's awesome. And what is the commitment level? So student fills out that application, they're selected as one of the 15. What commitment do you expect from them for that year or that 2 years?
So the federal government outlines the commitment. It's 2 years and it's 40 hours of didactic training and 40 hours of experiential training, each of the 2 years. And for those 2 years, AHEC Scholars can receive a stipend of $1,000 each year. Plus, we provide them with equipment, tools that they might need. They receive a backpack every year, and some years it contains books, some years it contains a stethoscope and blood pressure cuff, pen lights, reflex hammers, fun things to do. Last year they received a cube that they could look at the human brain and the heart and the lungs in a 3D capacity. So it all depends, what the students look like in that cohort, but it also drives each of the cohorts, because they're different, it also drives the programming that we do. So in the region, we have specific things that we need to cover, like social determinants of health. We need to cover health and poverty. We need to cover things on substance use disorders. And then the rest of the programming that occurs on the center level is dependent upon what the scholars are interested in. As an example, last year, we did a suture clinic with the senior scholars. And because not everyone is actually going to be in a clinical setting in their practice, those scholars are now able to at least be aware of what sutures are, how they go in, what they look like, how they are taken out. So it just heightens their awareness about if a patient presents and say they're a dental hygiene student and they happen to notice sutures on someone's arm that don't look right, they can say to that patient, I think you better have that looked at. We do have experts that train our students. So as an example, we have a physician who's on our board, and she provides a lot of the physical assessment and training that the students receive. We have nurses, we have public health professionals, we have educators. So we tend to bring to the cohorts, and when I say cohorts, they're first year and second year, we tend to bring to them what they've expressed interest in or where we assess them to be needing additional skills and information.
That's excellent. And so the 40 hours didactic and 40 hours experiential, that training adds into those hours, right?
Right. So my job is to not only set the center level curriculum, but it's also to help the scholars achieve those hours. So not only do we have group activities, and in the time of COVID, most of what we do is virtual, but we also have resources that the scholars can utilize through independent studies. When we look at experiential training, that can be anything from being placed in a health department, shadowing a physician, shadowing a nurse, going into a community organization, say like a mental health organization, and spending time there. It can also look like one-day trips. So every spring we do what we call Beyond the Beltway, and we load up in a yellow school bus and we tour some of the underserved areas in the city of Youngstown. And this year we're going to add the city of Warren. And we have people who live in those communities coming onto the bus and explaining, how difficult it is to get groceries, how hard it is to get transportation to see a physician, or a dentist or a speech pathologist. And so they give the scholars an opportunity to ask questions. And they also help the scholars understand that if they have a patient who's not following through with their plan of care, there may be reasons that the patient doesn't want to talk about that contribute to that. And so as a healthcare provider, it's our job to make sure that we're assessing that patient and we know that patient and some of the obstacles they have so that we can start providing more comprehensive healthcare. So the 40 hours of didactic and 40 hours of experiential are requirements. But again, I work with the students to make sure that those requirements fulfill some of the needs that they have in their interests and in their training.
That sounds awesome. And who wouldn't want to work with Maureen to get their hours in? I mean, you can just tell she's an awesome person. So thank you, Maureen. And I love that it's so customizable to the cohort, to the student, and you're learning about customizable healthcare too for the patient. So that's awesome.
Yes.
So go ahead.
That's probably the most important thing we want the scholars to walk away with. The most important premise is that when you have a patient, you really need to look beyond what they're presenting with. You really need to ask them questions about, you know, what's it like at your house, especially maybe for older people, you know, do you have a lot of rugs in your house? You know, are there things that you struggle with? Can you get your medications? You know, are you getting enough groceries and fresh produce? So in the trainings that we provide, we drill down to those important pieces of how people live and not necessarily how they present to you. And we work on making sure that our students walk away without those biases, so that they're not making assumptions just based on someone's physical or behavioral appearance.
Sure. So a lot of awareness training.
Mm-hmm.
Chelsea, with all this talk about the commitments and the hours and the extra, you know, field trips and everything, what would you say if someone says, well, I don't have time for that? How have you managed getting those hours in, being part of the Scholars Program, and being a full-time nursing student?
Yeah, sure. So I'll admit I was a little nervous at first because, you know, obviously, like, you know, nursing school, it's not easy. Not exactly the easiest, you know, to go through. So I was a little nervous at first, but Maureen has been wonderful with making sure that we get our hours and that they're relevant hours. So honestly, everything that I've been a part of has been something I've been excited to be a part of. And I'm going to make time for things that I'm excited to be a part of. So honestly, it wasn't overwhelming for me. It has never felt like I'm getting behind in school because I'm doing AHEC. They kind of just seem to flow together and work together nicely. And now that year goes from September to August. So I got some of my hours over the summer when I wasn't in school. And so that's an option as well. And it actually worked out good for me because I felt like I wasn't kind of sinking into my couch cushions over break. I was able to keep my brain going and kind of keeping that healthcare mindset. And so really, it honestly, it wasn't that difficult. Obviously, you want to make sure that you're organized, but I feel like people that have made it into the nursing program, usually our nursing students are organized and keep a calendar. And I never once felt like it was too overwhelming for me.
That's amazing. That's great. So favorite part for you, Chelsea? What's been your favorite part so far in your first year with AHEC?
So that's so hard to decide. Honestly, it's hard for me to pick one. I miss the in-person. I know, you know, nobody really likes this only being online thing, but I've really enjoyed our trips to Neomed because it's such a large group of AHEC scholars. You get to meet other AHEC scholars that are in other communities that, you know, you're not used to. So you get to talk to them about their experience. So that's probably been one of my favorite aspects of AHEC.
That sounds amazing. And that reiterates the interdisciplinary approach to healthcare, and that you're collaborating with pre-med students, maybe dental, maybe occupational therapy. It's really
Yes, absolutely. And, everybody in the program, wants to learn about each other's field and wants to learn a little bit more. So we can talk about, what's their workload look like? What are they looking to do after graduation? And it kind of just opens your mind up a little bit to like what other fields are out there. And plus, once we're practicing in healthcare, once I'm a nurse and once the other AHEC scholars are in their field of choice, we now have those connections. So I can reach out to one of those fellow AHEC scholars and say, hey, what do you think about this? Or, we kind of are like interconnected through AHEC scholars.
That's awesome. Maureen, can you touch on why a nurse or a nursing student is better off having done AHEC?
I think what Chelsea just said, we encourage strong interprofessional relationships and knowing what one another does in their disciplines. And so it's been tough because most of our trainings, we were able to get together. And one that comes to mind for me is we do an assessment. For those disciplines who do assessments in their clinical rotations, like dental hygiene and nursing, we have the students lead that assessment piece. And it's amazing to me the number of students who may not have that component to their curriculum, how much they learn and how many questions they ask of their fellow scholars about, well, why would you ask them this question? Or I didn't know that, so much disease in a mouth could cause other physical health issues. And so I think, we're just learning now. The first cohort graduated in 2020, and I can tell you, I already know that the 5 students that went off to medical school have kept in contact with one another to keep talking about, oh my gosh, what are you doing for this? What are you doing for that? And I think that's the important piece, especially for disciplines like nursing. When you're on the front line, you're in critical care kinds of circumstances, that you can call somebody who, maybe in another hospital and say, hey, I have this problem and I need to just run it by you. We've had 2 nurses graduate last in the first cohort, and I can tell you they've already been in contact with one another, comparing notes on patients and just maneuvering through healthcare systems, because it seems like every employment opportunity is different for every person.
Sure, that's awesome. Now, Chelsea, your perspective, how do you believe AHEC is going to help you in your nursing career? Because you have 1 more year and you'll be a nurse.
I know, it's crazy. I can't wait. Honestly, I think it's going to make me a better nurse. Anybody that knows a nurse knows that we're just inherently strong, fierce advocates on behalf of our patients. It just comes naturally to us. And to me, the best way to be an advocate on behalf of my patients is to better understand them and to better understand the community that I'm serving. And I feel like AHEC has really opened my eyes and granted me the opportunity to see that healthcare disparities do exist, and social determinants of health are a very important factor to consider. And so I think it's built my confidence when I'm working with members of the community, and it's also increased my empathy towards my patients. And I feel like that's just going to make me a better nurse. So yeah.
Awesome.
If I can add something else, I think, when you look at clinical practice, or you look at a hospital setting, or even a doctor's office, nurses are connectors. So they're usually the first people who see a patient, and they usually see the patient the most. So they're going to be aware of what's going on with that patient, and they're going to be able to tell other healthcare providers, whether it's in the hospital or in a multidisciplined clinical setting, they're going to be able to lead that charge and say, this is what's going on. And because I know, say you're a dietitian, I know she's having a problem with her nutrition, you can jump in and help. So nursing certainly is that one profession that connects all the dots.
Sure. And I imagine once AHEC scholars graduate and they're in the profession, there's instances that come up and they're like, well, I'm glad I did AHEC because now I know what that is. Like so many times if you're in the patient's room, it's like, man, I wish I had learned about that. AHEC scholars could say, man, I'm glad I learned about that.
Yeah, absolutely.
So, that's really cool. Chelsea, do you want to share anything else, maybe encouraging your fellow Kent State Trumbull BSN students, maybe sophomores, juniors that are watching this? Why should they choose to do AHEC Scholars Program?
Sure. I'd love to see more Kent State Trumbull students participate. I think that not only does it help build your leadership skills and give you all the opportunities, even more than what we touched on today, it helps you to network even, and you're not only meeting peers in other fields of study in healthcare, but you're talking to city health commissioners and, healthcare officials that, that's a good connection to have, especially when you're starting out your career. If you've already got connections, that's a powerful thing to have in anybody's career. So, if these opportunities that we listed aren't enough, which I feel like, that was enough for me to join, even just for the sense of networking and meeting people.
Sure. That's a great bottom line, the connections, the networking, and also just the awareness, I think, is big of, wherever you're a nurse, wherever you're in healthcare, you're meeting people from different walks of life, and to have that awareness of who they are.
Absolutely. And it's really relevant in the Mahoning Valley. It's really relevant in this area. We have such a diverse group of people and populations of people in the Mahoning Valley, from race to socioeconomic status. It's just incredible to be able to talk about these healthcare disparities that exist. And it's very, very relevant to this community that, a lot of us are going to be working in when we graduate.
Sure. Well, as we wrap things up, Maureen, I'm going to give you a chance if there's anything else you want to share. And then we'd love to hear some contact information, how students can apply, what can they do next if they want more information.
Sure. I think just to follow up on what Chelsea said, if you feel strong and confident in your practice, you're also going to be advocates for changes in healthcare systems. And what the AHEC Scholars Program does is expose our cohorts to how that can happen and who needs to know about, the issues that they're seeing. So she hasn't experienced it yet, but we're connecting our senior scholars to our legislators, to, the Ohio Department of Health, the leadership there, the Ohio Department of Minority Health. So we bring in people who have the ability to change something, and we connect not only our scholars, but other people so that our legislators know what's challenging our local communities. So if students want to be a part of the AHEC Scholars Program, they can contact me. My email is eoahec@gmail.com. They can also look on our Facebook page and send a message through Facebook. Our Facebook page is Eastern Ohio AHEC. And it's also a good place to look at pictures, see what our scholars have done in the past. There's usually an update, a couple times a week. It's just fun to look at, and it gives you an idea. Later on this week, I'll be posting a new video about our AHEC Scholars Program. So look for that. It's a lot of fun to watch the students grow through their 2 years.
Thank you so much, Maureen. Thank you so much, Chelsea. It's great to hear from both of your experiences. 30 years for you, Maureen, 1 year for you, Chelsea. Who knows what's next? But it's just great to hear about this. And I hope that if you're watching and you think, oh, maybe I'm interested, please reach out. It doesn't hurt to explore this option for you. It might be what makes the difference in landing your first job. It might be a way to network, make connections, and it will definitely help you in that cultural sensitivity in your nursing practice or other healthcare fields. So thanks for watching, and we hope that you have a great rest of your day.
Thank you.